In other headlines this weekend, the director of Arizona's Division of Emergency Management stepped down. Wendy Smith-Reeves submitted her resignation to the governor's office Saturday. She has been part of the state's response to the COVID-19 emergency. An acting director has already been named. A day earlier and hours before Mayor Romero issued her latest proclamation, I spoke to Governor Doug Ducey about how his administration is weighing a stay-at-home order for the state.
We are absolutely considering every tool in the toolbox. The authorities given to a governor in a public health emergency are vast. So I want to make the right decisions in the best interest of Arizona to protect our citizens and protect public health and promote good public health. So we have escalated it as this situation has escalated, and everything's on the table right now. We've, of course, shut down restaurants and bars. We've gone to takeout only. Our schools are closed. We've had an emergency declaration. We've had a lot of executive orders, and I expect those to continue to extend to the appropriateness of whatever's necessary. My guidance has been with the Centers for Disease Control and Prevention and Dr. Kara Christ, who is a medical doctor and infectious disease epidemiologist. She's the individual who steered the state through H1N1, Ebola, the measles, and that's where our guidance is, and we'll continue to follow the facts and listen to the subject matter experts.
Many people are questioning how you've decided who's essential and who's not. What sort of guidelines are you operating with to make sure that you have the best information available?
Arizona is not in the same situation as some other states that we're seeing across the country. So we are able to really learn from some of those that are getting hit well before we're going to face that kind of surge activity that will be necessary in the state of Arizona. So we want people, of course, if you can stay home, stay home. If you're sick, you've got to stay home. But if you're part of an essential business, if you're able to work, you're able to what we say physical distance. A lot of people are saying social distancing. It's that idea of keeping a 6 feet of distance between yourself and others, just like I'm doing during this interview. You can still go out and do what you need to do.
Any preparation for field hospitals in the state of Arizona?
Yes, all hands are on deck right now. We want to make sure that we have the proper hospital capacity, not only at the state level, but for additional field hospitals. We anticipate, and this is worst case scenario planning, Lorraine, but when you have a pandemic, you need to plan for worst case scenarios. And it would be two additional field hospitals in Maricopa County and one in Pima County, worst case scenario.
There are some vulnerable populations in the state of Arizona, to include the inmate population or immigrants who are afraid to go to the hospital, even tribal communities where some resources like water can be scarce. Are they all being considered during these decisions?
Oh, absolutely. I mean, that's who we're most concerned about, is our most vulnerable population. And I'm glad that you pointed that out. First and foremost, it is people that are 65 years old or older with an underlying health condition or a chronic health condition. And we're doing everything we can to keep any spread out of the retirement homes, those communities that we have around our state. That was actually my first executive order. And we're taking that same type of mentality, of course, to our prison inmates, the way we're working with our correctional officers and the off-site work. Our tribal communities are getting hit hard. We've got additional help and assistance from our federal government and the National Guard to pay attention to that situation.
The mayors in border communities like Douglas, San Luis, Nogales are worried about their tax revenue. Arizona has $1 billion in its rainy day fund. Any plans to direct that money toward them?
Public health is first and foremost. After that, my concern is about economic relief, and our great Arizonans that live paycheck to paycheck, have never asked for anything from the government, and all of a sudden there's no income coming in. So with the passage of the economic relief package in Washington this past week and what we're going to be able to do at the state level, we're going to use everything we have, and we've got more than a rainy day in front of us right now. And the good news is we're in a strong financial position to navigate through this together, and we are going to get through this together. This is going to be a marathon, not a sprint. I'm very confident we're going to come out of this on the other side stronger and healthier as a state, but we've got a ways to go. And the first concern right now is public health, to reduce the transmission of this disease, to take care of those that are sick, to try to reduce the amount of deaths that we're going to face. And then we want to make sure nobody falls through the social safety net.
Dr. Chris says we have not hit the peak yet. If we're not going to do things like stay-at-home directives, then how do we smash this curve?
Basically, Lorraine, I've been all over the state. The state is shut down. People are staying home. Kids are out of school. You look out the window at the state capitol, there's nothing on West Washington. There's nothing on the I-10. We'll escalate directives as CDC guidance determines that, but we are anticipating what's going to be necessary for April and May, and that's the way to lower and flatten the curve, to extend this so that we have hospital capacity and we can take care and comfort for everyone that's going to need it.
All right, Governor Ducey, thank you for your insight.